So here is another woman who's changed my life. Dr. Casey Means. Okay, you have to look her up, but she is changed the way I see exercise.
Memberships in the US have doubled since the year 2000, and obesity has gone up in the same period. So there's some mismatch between our obsession with exercise and our actual outcomes that we're seeing. And I think it's that we have not actually rebuilt constitutive movement into our daily lives.
So I've heard her talking about this before, and I didn't know, but there's actually studies that suggest that it's not necessarily like that you do a workout for an hour at 6 o'clock in the morning and then you sit at a desk for the rest of the day and that's going to make you healthy. No, we're actually designed, metabolically designed to move throughout the day, more and less at different times. And I suppose if you think about what I would have been designed for as a woman, it would have been the child rearing and hunter or the gatherer role, which would have meant that I would have been constantly moving throughout the day because I would have been running around after kids, and then I would have been walking for a long time trying to gather things to eat. So it is great, I think, and I am not knocking exercise in any form because I think it's great. And there is another woman, I can't remember her name, and she talked about she talks about movement, any sort of movement, whether it's cleaning or dancing or walking or jogging or like anything at all, it doesn't matter. Moving your body, it's the sitting down for hours and hours on end that's killing us all metabolically.
Concept of exercise is something we're really very wedded to in our Western culture. And you look at more like the blue zones and the centenarians, they're kind of moving is built into their everyday life. We think that exercise replaces that all day movement. Biochemically, it does not. So I think a big part of digging ourselves out of this chronic disease mess and creating capacity for mitochondria is finding ways to take a lot of the activities we do now seated and just find a way to do more of them moving, standing, or walking, or every 30 minutes, taking 2 minutes to do light movement, flex those muscles, get the glucose channels at the membrane, get the mitochondria.
Yeah, again, so she's pointing out here how it's good for the mitochondria to move regularly. So, what I do is, and it's also known as well that you want to get your glucose out. If you do eat carbs, you want to get your glucose out of the blood. So, having a walk after you eat a carb meal will reduce the spike that you get. If you take a walk for 30 minutes after your dinner and you've had like some carbs in there, it will reduce the spike you're going to have. That's been proven as well. So but it's also like I think the doing an hour at the gym, that's great for, let's say you want to build muscle, or let's say you're doing going for a jog. Like as someone with anxiety, there is nothing better than jogging to clear your head when you've got anxiety. It's really, really good. Is it healing my mitochondria and reducing inflammation? I don't know. Like, is that the best way? No, like you need to put in some strength training, especially because I'm a woman in my mid 40s, so I do need to strength train too. But I'm not knocking cardio, like it's fantastic for just clearing my head and I love it. But I have started just kind of because I'm agoraphobia, I will just like walk around my garden, just do laps. And I that works for me because it just means that like I'm constantly kind of just going out and trying to, like I might sit down for 2 or 3 hours for work, which is not ideal, but you can't always get everything that you need. Like you can't, sometimes you've just got to sit down at a desk for a couple of hours because you've got a job. But I do try my best to incorporate movement into my life, and that's because of some of the research I've heard Dr. Casey Means talk about. So you really should check her out. So here she's talking about mitochondria and glucose.
2 minutes to do light movement, flex those muscles, get the glucose channels at the membrane, get the mitochondria active. Our gym members.
So, she's saying there about getting mitochondria active, which is good. Yeah, I really like her. She's got a lot of great things that she talks about, but She's definitely changed the way that I move, the way that I see exercise as well.